हेलो एवरीवन। आज का वीडियो आपके लिए, आपके फ्रेंड्स के लिए, आपके पेरेंट्स के लिए, आपके फैमिली मेंबर्स के लिए बहुत ही ज्यादा इंपॉर्टेंट, क्योंकि आज मेरे आपको एक बहुत ही ज्यादा इंपॉर्टेंट इंफॉर्मेशन देने वाली है एंड दैट इज अबाउट एमपॉक्स और प्रीवियसली कॉल्ड मंकी पॉक्स which was declared as a global health emergency by WHO, that is the World Health Organization. So WHO, that is the World Health Organization, classified this monkeypox or the Mpox as a grade 3 health emergency situation. So through this video, I will be discussing everything about Mpox in the most simplified manner. And also, if you are new to this channel, please appreciate my work by hitting the subscribe button, liking this video, and also smashing the bell icon so that you don't miss any new notifications. So Mpox belongs to the family of Poxviridae family with the genus of the orthopox viruses. So other members of this orthopox virus genome are variola virus, vaccinia virus, and the cowpox virus. And also this Mpox is also an enveloped virus. And we all know that all pox viruses are DNA viruses. Therefore, Mpox is also a DNA virus. And we all know that all the DNA viruses have double-stranded DNA as its genome. Therefore, Mpox is also having double-stranded DNA as its genome. But an important exception to this fact is parvovirus, which is a DNA virus, but it is not having double-stranded DNA as its genome. So there are two clades for this virus, that is clade 1 and clade 2. And among clade 1 and clade 2, clade 1 is considered the most dangerous, most severe, and it is having a high infectivity rate. And also the case fatality rate is also so high in this clade 1 virus. And now in 2024, this clade 1 is actually spreading across the world. So this Mpox is also a zoonotic disease. So what are these zoonotic diseases? Zoonotic diseases are those diseases that are transmitted from the animals to humans. So this Mpox is also a viral zoonotic disease. But what is that thing very special about Mpox disease is that Mpox is a virus that can also transmit from humans to humans. So this Mpox is a viral zoonotic disease that can actually show its transmission from humans to humans also. So there are two modes of transmission, that is from animals to humans and also from humans to humans. So that is what is about the transmission of Mpox is all about. Being a zoonotic disease, the main important reservoir of this Mpox virus is actually animals. But the information regarding the exact mechanism on how this is actually existing or surviving in nature, what are the important reservoirs of this Mpox virus, all these informations are still unknown to us. The Mpox virus was first identified in 1958 in African monkeys. Therefore, it was named previously as monkeypox. But over the years, it was found out that this Mpox virus is also seen in other rodents like Gambian pouch rat, dormice, tree squirrels, and all. Therefore, it was renamed as Mpox from monkeypox. So the first case of Mpox virus was reported in 1970 in Democratic Republic of Congo in a 9-month-old baby. From there, it spread through a lot of other African countries, and today in 2024, about 110 countries including Gulf countries, India, Pakistan, Uganda are all affected with this Mpox virus. Main modes of transmission of the Mpox virus include the contact with the blood, body fluids, cutaneous and the mucosal lesions, and also by the infected animal. And also, it is also said that there is also a transmission through sexual contact also. There is also transmission from the animals to humans if the humans start ingesting the meat of the infected animal. Also, there is also a risk of transmission through the respiratory materials and also by using the materials used by the infected persons like the garments, linen, and also the utensils. Also, this virus can cross the placenta. Therefore, congenital Mpox can also be seen. And also, this can be acquired during the time of delivery or after the birth through the close contact. The incubation period of Mpox virus is 5 to 21 days. After this, the patient starts showing the infection or develops the infection in two phases. That is in phase 1, that is the prodromal phase, and phase 2. In phase 1, the virus starts invading the body of the patient. During this time, the patient presents with the complaints of high-grade fever, headache, backache, and also myalgia. and also there is intense physical exhaustion and also intense nausea will be seen. During this time, check for lymphadenopathy, mainly cervical, submandibular and sublingual lymphadenopathy. Because lymphadenopathy is not at all seen in case of other similar infections of chickenpox, smallpox and also measles. Lymphadenopathy is just present in case of monkeypox only. In phase 2, the patient presents with the complaints of rashes. That is, this rash develops after 1 to 3 days of fever, and now the rashes are more concentrated on the face and also the extremities and is not at all seen, or it is less concentrated in the trunk region. 90% patients will be complaining of the rashes on their face. 75% patients will be complaining of the rashes in their soles and palms, and 70% patients will be complaining of the rashes in the oral mucosa, and 30% patients will be complaining of the genital rashes, and the 20% patients will be complaining of the rashes in the conjunctiva. The rashes actually progresses from the macules to the papules, and then from the vesicles to the pustules, and finally it forms a scab or a crest, and that actually falls off after some days. The case fatality rate, that is the CFR, is actually 0 to 11%, but now the case fatality rate is actually 3 to 6%. So talking about the lab diagnosis of this Mpox, the best method is actually the PCR, that is a polymerase chain reaction, and the specimen you can use is actually the scabs or the dry crest or the fluids from this pustules or the macules, and also you can use biopsy also. The serological tests are not useful in case of Mpox viruses because of the cross-reactivity between different orthopox viruses. And also, individuals who are vaccinated against the smallpox recently will also show a false serological test. So the treatment for Mpox virus includes the hydration and also giving antiviral agents like tecovirimat. So the vaccines include the vaccine for the smallpox virus is proved to be 85% effective against the Mpox virus also. So talking about the complications of Mpox, patients actually show a good outcome against this Mpox virus. Now, in some immunocompromised people, that is the patients with low immunity, and also in some individuals, that is in some rare cases, myopericarditis, vision loss, etc. is also associated with this Mpox infection. So the preventive methods of Mpox includes avoid contact with the animals, avoid contacts with the animal products, and also avoid contact with the infected person, and also isolate the infected person. Hand hygiene should be properly followed, and also sanitization process should be followed. Avoid contact with the materials used by the infected person, and also avoid the sexual contact with unknown persons and also with multiple partners.